Have you ever felt an odd, unexplained sensation in your body and wondered if it might be something serious? The truth is, there are certain warning signs you should never ignore. They could mean your body is giving you a final call for help. When doctors spot these symptoms, they know something life-threatening could be just around the corner. In this video, we're going to uncover 6 warning signs that experts say could signal the end is near. These signs might seem harmless at first, but if you notice them, they could be trying to tell you something crucial about your health. From sudden, relentless fatigue to sharp pains deep in your chest, each of these symptoms is your body's way of sounding the alarm. Stay with me until the end, because this information could genuinely save your life. By recognizing these warning signs early and taking action, you can regain control of your health before it's too late. So, let's get started. Number 1. Unexplained extreme fatigue. There's a big difference between feeling tired after a long day and experiencing a level of exhaustion that seems to have no explanation. If you feel completely drained even after a full night's sleep, or if everyday activities suddenly feel impossible, it could be your body warning you that something is seriously wrong. This kind of exhaustion isn't the kind you fix with a cup of coffee or a quick nap. It lingers, it weighs you down, and, most importantly, it comes with no clear reason. Maybe you used to go for daily walks, but now feel wiped out after just a few steps. Maybe simple things like cooking, dressing, or even having a conversation feel like too much effort. This isn't just aging. It could be a sign that your organs are struggling, that your heart isn't pumping as it should, or that your body is shutting down essential functions to conserve energy. Doctors see this all the time, especially in patients with heart disease, kidney failure, or even advanced cancer. When your body is using everything it has just to keep going, fatigue becomes overwhelming. It's not normal, and it's not something to ignore. One of the most telling signs is when this fatigue suddenly appears or gets worse over time. If you used to have good energy but now feel weak and drained without an obvious reason, that's when you need to take action. Your body isn't just tired, it's warning you that something deeper is happening. So, what should you do? Pay attention to when this fatigue started, what makes it worse, and whether it's stopping you from doing things you once enjoyed. If it's getting worse and interfering with your daily life, it's time to see a doctor. The earlier you act, the better your chances of finding out what's wrong and getting ahead of it before it's too late. Number 2. Sudden and severe chest pain or pressure. There's one feeling you should never ignore: a crushing, squeezing, or intense pressure in your chest. If this happens out of nowhere, especially if it spreads to your arm, neck, jaw, or back, you could be seconds away from disaster. Doctors warn that chest pain like this is often a sign of an imminent heart attack or a life-threatening aortic dissection. Many people make the mistake of brushing it off, thinking it's just heartburn or muscle strain. But when a doctor hears about this kind of pain, they don't take chances, because waiting too long can mean the difference between survival and tragedy. The most dangerous kind of chest pain feels like a weight pressing down on you, making it hard to breathe. It may start slowly and worsen over time, or it may hit you like a sudden punch to the chest. Either way, it's your body screaming for help. Here's what you need to know. Heart attacks don't always look like the dramatic scenes you see in movies. Sometimes the symptoms are mild, just a discomfort in your chest or upper body, combined with nausea, dizziness, or sweating. That's why many people ignore it until it's too late. And if the pain is sharp, tearing, or feels like something is ripping inside your chest, it could mean your aorta, the body's largest artery, is tearing apart. This is one of the deadliest medical emergencies there is, and it requires immediate surgery to prevent fatal internal bleeding. So, what should you do? If you ever feel sudden, severe chest pain, don't wait. Don't lie down and hope it passes. Don't convince yourself it's just stress. Call emergency services immediately. The faster you get medical attention, the greater your chances of surviving. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3. Difficulty breathing or shortness of breath. Imagine this. You're sitting in your chair not doing anything strenuous, but suddenly you feel like you can't catch your breath. It's as if the air has suddenly become thinner, and no matter how deeply you inhale, it's not enough. This isn't just discomfort. It's a major red flag. Doctors warn that unexplained shortness of breath is often the body's way of signaling that something critical is failing. It can be a sign of advanced heart failure, a dangerous blood clot in the lungs, or even a silent heart attack. Many people assume that trouble breathing is just a sign of getting older, but when it comes on suddenly or gets worse over time, it's something you can't afford to ignore. One of the most life-threatening causes of sudden breathlessness is a pulmonary embolism, a blood clot that travels to your lungs. This can happen without warning, especially if you've been sitting for long periods or recently had surgery. The scary part? It often starts with just a little discomfort, maybe a feeling of tightness in your chest, and then suddenly it feels like you're suffocating. Another possibility is congestive heart failure, where fluid builds up in your lungs because your heart isn't pumping properly. This makes it harder to breathe, especially when lying down. Some people even wake up gasping for air in the middle of the night. And then there's the warning that's often overlooked: a silent heart attack. Unlike the classic crushing chest pain, this type of heart attack shows up as extreme shortness of breath, nausea, cold sweats, and an overwhelming sense of fatigue. Many people don't realize they're having a heart attack until it's too late. So, what should you do? If you ever feel short of breath for no clear reason, especially if it happens suddenly, don't wait. Sit down, stay calm, and seek medical attention immediately. If it's a clot, an issue with your heart, or a serious lung condition, acting fast could save your life. Now, let's talk about another silent but deadly warning sign: drastic, unexplained weight loss. Number 4. Drastic and unexplained weight loss. Losing weight without trying might sound like a good thing until you realize it could be a serious warning sign. If the pounds are slipping off and you haven't changed your diet or exercise routine, your body could be fighting something far more dangerous than you realize. Doctors warn that rapid, unintentional weight loss, especially in older adults, can signal advanced disease. One of the biggest culprits: cancer. Certain cancers, especially those of the pancreas, lungs, or digestive system, can cause sudden weight loss before any other symptoms appear. This happens because cancer changes the way your body processes energy, burning through calories at an alarming rate. But it's not just cancer. Drastic weight loss can also be a sign of severe metabolic disorders, undiagnosed diabetes, or even heart failure. When your body isn't absorbing nutrients properly, muscle and fat begin to disappear, leaving you feeling weaker, more fatigued, and increasingly frail. If your clothes feel looser, your belt needs to be tightened more often, or people keep telling you that you look thinner even though you haven't tried to lose weight. It's time to pay attention. There's another reason why this happens, one that many people don't think about: chronic inflammation and infections. Your immune system works overtime when your body is fighting an illness, burning through energy reserves and making you lose weight without even realizing it. Conditions like tuberculosis, chronic infections, or autoimmune diseases can drain your body's resources, leading to sudden weight loss that seems to have no cause. So, what should you do? If you've lost more than 5% of your body weight in a short period of time without trying, it's a red flag. Don't assume it's just part of getting older. Schedule a medical checkup, get your blood work done, and insist on answers. The sooner you identify the cause, the better your chances of stopping something serious before it's too late. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 5. Confusion, disorientation, or sudden personality changes. There's something unsettling about feeling like your own mind is slipping away. If you or someone you love suddenly starts forgetting things, getting easily confused, or acting differently without explanation, it could be a sign that something serious is happening inside the brain. Doctors warn that rapid mental decline, especially when it comes out of nowhere, can be a sign of a stroke, brain infection, or even an advanced neurological disease. A stroke, for example, can cause sudden confusion, slurred speech, or an inability to recognize familiar faces and places. Some people experience a brief episode where they seem off, and then minutes or hours later, they are completely fine. This could be a transient ischemic attack, a mini-stroke. A brain infection can trigger sudden disorientation, especially in older adults. If someone suddenly seems distant, agitated, or struggles to hold a normal conversation, it might not be just old age. Infections can spread rapidly through the body, affecting the brain and causing delirium, a state of confusion that can appear overnight. And then there's the possibility of Alzheimer's or other forms of dementia. While these conditions typically develop over time, some people experience a sharp decline all at once, losing track of time, forgetting recent events, or struggling with basic tasks that used to be second nature. One of the biggest mistakes people make is assuming that sudden confusion is normal for aging. It's not. When the brain starts malfunctioning quickly, it's often because of an underlying medical condition, one that could be deadly if left untreated. So, what should you do? If you notice sudden changes in memory, behavior, or awareness, seek medical attention immediately. Whether it's a stroke, an infection, or something else, these are not symptoms to brush aside. Acting fast can make all the difference, because when it comes to brain health, every second counts. Now, let's talk about the final and often most painful warning sign: severe and persistent abdominal pain. Number 6. Severe and persistent abdominal pain. A stomachache might not seem like a big deal, but when the pain is deep, sharp, or refuses to go away, it could be something far more dangerous than simple indigestion. Doctors warn that severe abdominal pain, especially if it comes on suddenly or lasts for hours, can be a sign that something inside your body is breaking down. One of the most critical concerns is a ruptured abdominal aortic aneurysm. This is when a weakened section of the aorta, the body's main artery, bursts, causing internal bleeding that can turn fatal within minutes. The pain is often described as a deep, unrelenting sensation in the stomach, lower back, or sides, sometimes pulsing with every heartbeat. If this happens, immediate emergency care is the only thing that can save your life. Another life-threatening cause of severe abdominal pain is intestinal blockage or ischemia, when blood flow to the intestines is suddenly cut off. This can happen due to a twisted bowel, a dangerous clot, or even advanced cancer. If your stomach feels swollen, hard, or tender to the touch, especially if you haven't had normal bowel movements for a while, it's a red flag. And then there's pancreatitis, an inflammation of the pancreas that can cause intense pain in the upper abdomen, sometimes radiating to the back. It can come on suddenly and worsen after eating, making even simple meals unbearable. This condition can quickly escalate, leading to serious complications like organ failure if ignored. Some people also experience gallbladder attacks, which cause sharp stabbing pain under the ribs, often triggered by fatty foods. Many mistake this for acid reflux or gas, but when the gallbladder becomes inflamed or blocked by stones, it can cause life-threatening infections. So, what should you do? If you ever feel an unexplained, persistent, or excruciating pain in your abdomen, don't wait. Get medical attention immediately, especially if it's accompanied by fever, vomiting, or sudden weakness. Some conditions require surgery, and delaying care could make all the difference between recovery and a much worse outcome. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Final thoughts. If you've made it this far, you now understand that your body gives you warning signs long before disaster strikes. The key is knowing what to look for and acting fast when something feels wrong. Ignoring these symptoms or assuming they'll just go away can be a fatal mistake. We've covered 6 major signs that could indicate your body is in serious trouble. Whether it's sudden chest pain, unexplained weight loss, shortness of breath, confusion, or severe abdominal pain, these are not symptoms to brush off. When something feels off, listen to your body. It's always better to seek medical attention and be told it's nothing than to wait until it's too late. One of the biggest challenges as we get older is recognizing that our health can change in an instant. But here's the good news: being informed puts you in control. And knowing these warning signs means you have the power to protect yourself, to take action when it matters most. You don't have to live in fear, but you do have to stay aware. Now, I'd love to hear from you. Have you or someone you know ever experienced one of these warning signs? What did you do about it? Sharing your experience in the comments below could help someone else recognize a symptom before it's too late. Thank you so much for spending your time with us today. We'd love to hear your thoughts. Drop a comment below and tell us one thing you learned and how you'll put it into practice. Your feedback means a lot to us, so please don't hold back. Reading your comments inspires and motivates us to keep going. If you found this video useful, don't forget to like, subscribe, and share it with others. Your support makes it possible for us to keep creating valuable content that informs and uplifts. Thanks again for watching. We can't wait to see you in the next video.